Are there specific tests for mixed dementia? When it comes to mixed dementia, many people wonder if there are specific tests to diagnose it. Mixed dementia is a condition where more than one type of dementia occurs at the same time in the brain. The most common combination is Alzheimer's disease and vascular dementia. Diagnosing mixed dementia can be quite challenging because the symptoms often overlap and the brain changes involved are complex. There are no single tests that can definitively diagnose mixed dementia. Instead, doctors use a combination of methods to identify the presence of multiple contributing factors. First, a thorough clinical evaluation and cognitive testing are essential. Doctors will take a detailed medical history and conduct cognitive assessments to evaluate memory, thinking, language, and daily functioning. Common tools for this include the Mini Mental State Examination and the Clinical Dementia Rating Scale. These tests provide snapshots of cognitive abilities over time but cannot distinguish mixed dementia from other forms of dementia on their own. Next, brain imaging plays a crucial role in the diagnostic process. Techniques such as magnetic resonance imaging, computed tomography scans, and positron emission tomography scans are used to detect changes in the brain. MRI and CT scans can reveal vascular damage, such as strokes or small vessel disease, alongside the brain atrophy that is typical of Alzheimer's disease. PET scans can identify amyloid plaques or tau protein deposits, which are characteristic of Alzheimer's disease. The combination of vascular lesions and Alzheimer-type changes on imaging can support a diagnosis of mixed dementia. In addition to imaging, biomarkers in blood or cerebrospinal fluid can provide further evidence. Tests that measure biomarkers related to Alzheimer's disease, like amyloid beta and tau proteins, as well as markers of vascular injury, can help clarify the underlying pathology. However, these biomarker tests are not yet widely used in routine clinical practice. Finally, it is important to rule out other conditions that may mimic dementia symptoms. Physical examinations and laboratory tests can help identify issues like vitamin deficiencies, thyroid problems, or infections that could cause similar cognitive changes. In summary, diagnosing mixed dementia relies on a comprehensive clinical assessment, cognitive testing, brain imaging, and sometimes biomarker analysis. No single test can confirm mixed dementia. It is the integration of multiple diagnostic tools and clinical judgment that leads to this diagnosis. If you or someone you know is experiencing memory loss or cognitive changes, it is essential to seek evaluation from healthcare professionals specializing in dementia. Early and accurate diagnosis can guide appropriate management and care tailored to individual needs.